And Community Chloe, I'm so excited here at Radio 1 Richmond about her story, RVA, which is a virtual women's empowerment series curated with Black women in mind. This episode is sponsored by Virginia Neonatal Perinatal Collaborative. So I have some very special guests that are joining me tonight. Founder and executive director of Urban Baby Beginnings, Stephanie Spencer. Come on in, Stephanie.
Hi, Chloe. It's great to be here again.
And we also have Maternal Infant Health Director for March of Dimes joining us, Tiffany Carter. How are you?
Hi, Chloe. It's so good to be here.
Thank you so much for coming on. Well, I'm excited to introduce our very special guest that is joining us tonight. And we're going to have a serious discussion to share. She's going to share her knowledge and experience as she continues to bring awareness towards navigating preconception care. Dr. Giles is committed to the service of underserved patient populations and to the training of future medical professionals that offer medically and culturally competent care. That is so important. Without further ado, welcome Dr. Lambert Giles. How are you?
Hi, everyone. Thank you so much for having me.
I want to thank all folks for being here. Now we're going to tap in to this community conversation centered around community support for mothers, birthing people, and their children. Now, this is going to be a question to all of the panelists. We're going to start with you, Stephanie, then Tiffany, and then we'll go to Dr. Giles. Tonight, we are talking about the importance of preconception care and pushing for healthy pregnancies, babies, and postpartum recovery. In your own words, starting with you again, Stephanie, what does preconception care mean to you, and why is it so important?
I feel like one of the things that's so important is that we really talk about nourishing our mind, body, and spirits and preparing ourselves for that pregnancy journey. And that starts long before we actually have a baby. I think that preconception care is really thinking about the care and support that you need, preparing your body, making sure you're as healthy as possible. Things like going to the doctor to check for health conditions, making healthy lifestyle choices, even thinking about the partner in which you wish to have your baby with. All those things really fall in the period of time before you actually conceive. So that's what I think. And the reason why it's so important is because there are so many risks that are involved by not addressing health-related concerns in the preconception period, which will carry over to when you become pregnant. And wouldn't it be so wonderful that if we really thought about care and the care for ourselves and our babies, that we prepared before we became pregnant? And we have an opportunity to do that before we do that. Or cut that out. We have an opportunity to think about what type of outcome we wish to have in our pregnancy and birth in the postpartum period. And that needs to start before we become pregnant.
Okay, so we're women. We can do things in any order that we want. So, Stephanie, before we go over to give Tiffany and Dr. Giles an opportunity to answer, share with our listeners a little bit about Urban Baby Beginnings.
Sure. Urban Baby Beginnings is a maternal health hub that provides pregnancy, birth, and postpartum support to community members. We have 4 locations across the state of Virginia, and they're really safe places where individuals can go to engage with doulas, community health workers, and other paraprofessionals who are all vested in ensuring that families, birthing people, and their babies are healthy.
Thank you, Stephanie, for that. Maternal Infant Health Director for the March of Dimes, Tiffany Carter. Tell us a little bit about what it is that you do over at the March of Dimes.
Well, March of Dimes, we say we're leading the fight for the health of all moms and babies. And what that means is we are working with people in your community. We're working with people on the state level. We're creating programs and different types of interventions, all to make sure that moms and babies can have the babies that they want, how they want, and do so safely. And what I do is I am the one that just works with all these people to make sure it happens. So I have a great job. Do you want me to answer the question now too?
Yeah, sure. You can answer now.
So preconception care basically is just what Stephanie said. It means taking care of yourself even before you get pregnant, and just valuing every phase of your life, not just the time that you're pregnant and becoming a mom. So things like staying active, having a healthy diet, regular checkups and screenings. And I'll also add it's important to prioritize your mental health as well.
Very
Um,
good.
all these things, they work together to make a healthy woman, which in turn makes a healthy mama when it comes time for you. And then ultimately it works toward a healthy pregnancy and a healthy baby.
Thank you so much for that, Tiffany. Well, I am so thankful. This is an evening of no white coats. Dr. Lambert Giles, thank you so much for
It's
joining us.
hanging in the back right there.
Oh my God. Well, it's a day of no copay and white coats. No white coats. We're excited this evening. So, Dr. Giles, tell us a little bit about what it is that you do.
Yes, so I'm Dr. Lambert Giles. I'm an OBGYN provider at VCU Medical Center. In this role, I also have the opportunity to teach at VCU Medical School and care for the medical students that are really rotating through our subspecialty and learning whether or not this is something that they want to be a part of. I serve as our division lead for diversity, equity, and inclusion. And we have recently started a student interest group about maternal health disparities, in which I am the faculty advisor as well.
All right. Well, Dr. Giles, thank you, OBGYN. So I'm pretty sure when it comes to the preconception care and you're pushing for healthier babies, as at OBGYN, you see a lot of things that's going on down there where you can say, look, we got to get it together.
Yeah, I mean, when I think of preconception care, I think of that thought, right? That the best offense is the best defense is the best offense, right?
Yeah.
And I think we kind of need to think about pregnancy not as something that kind of happens to us, but make pregnancy a choice. Make pregnancy something that we are actively pursuing, that we're actively preventing if we don't want it, but then actively pursuing if we do want that for our lives. And if we think of it in that way, we really want to make sure that we're optimizing all of the factors that can affect pregnancy and all of the factors that can affect your postpartum life. I know Stephanie and Tiffany mentioned like your medical health, your routine screens. I think things that we didn't realize or think about is what it looks like for preconception in financial planning, in work planning. All of those things I think are important. We have a lot of patients sometimes might be at a new job, and unfortunately, a new pregnancy at a new job can really place people in a financial pickle when they aren't yet protected by things like FMLA, when they don't yet have time to be able to take the leave that might be necessary or the leave that they might want to take postpartum for bonding and for care. So I think preconception counseling and preconception care means really taking care of yourself medically, being in an optimal place from a medical standpoint, but also really figuring out what life would look like after a baby, that time that you might need, what work looks like, what care for you and your baby might look like as well.
I think it's so important, Dr. Giles. Thank you so much for that. Because when you're thinking about it, sometimes babies are surprises.
Yeah.
But in the event, if we take the proper steps, we can make some of the right choices. And then when we do that, it all ties into the health of the baby. Number one, it ties into your environment, and it also ties into your future by just making simple choices to actually get assessed. Now, when we're talking about high quality care, if you will, can you share with our viewers, what is it about your organization and the roles there that ensures high quality care is provided when one comes into the preconception care?
Yeah. So the term high quality care is something that we kind of throw out in the world of medicine to say, oh, like we're doing a really good job at medicine, right? But the Institute of Medicine actually defined 6 goals and 6 domains for what should actually be considered high quality care. And that is that your care should be safe, that your care should be effective, that your care should be patient-centered, that your care should be timely, that it should be efficient, and that your care should be equitable. And I think 2 of those big factors are things that we don't always think about when we think of what's high quality care. We don't always think about it being patient-centered.
Amen.
or really do the work to make your care patient-centered. And we
Mhm.
don't always think about it being equitable. So I think a big part of my role here is trying for us to truly interrogate our system, interrogate the care that we are providing as individual providers, but
Mhm.
then as VCU in a whole to say, are we really being patient-centered? And how can we be more equitable in the care that we're providing so that we have more equitable outcomes?
Dr. Giles, thank you so much for that. We're going to move some of the questions around so we can give our other guests an opportunity to speak too. Trust is essential when it comes to having a team to back you up throughout your preconception care journey. Can each of you touch on why someone should feel okay to shop around to find the best fit for their care? Let's start with you, Stephanie.
Trust is so essential. I think that we don't often think that we have an opportunity to shop around. So I'm glad that you brought that up, Clovia. Um, when I think about care, I think about some of my journey in terms of being able to choose providers. I believe I was at a point when I first had my first child, I didn't realize that I could shop around for a provider. And so, as a result of that, some of the beliefs that I had regarding my care, some of the treatment that I received, which I would not have put up with, I ended up having to deal with because I didn't really interview my provider. And so, when it came to how I wanted to birth my baby, my postpartum care, really knowing about some of the things that were available to me, and even my prenatal care, like being able to talk with the provider and having a good relationship with them, it didn't exist. And so, trust is essential, but it's only built when you're with people who you feel comfortable with and who you've had an opportunity to get to know. So I always tell people that you do need to shop around and to realize that your insurance should not be a barrier to being able to do that.
Mhm. And you shouldn't feel insecure about it or feel
Right.
like you're questioning someone's professional uh,
Exactly.
activity or
Exactly.
arena, because sometimes people make you feel that way. And I know a lot of times when it comes to African American women, folks look at us as really strong women, and when something hurts us or bother us, it's not really that. But it is. We have issues and challenges. And for those mothers or birthing people who are aware that something is going on in their body, but if you don't feel like something is right, you have to build that trust. And I'm speaking from a mother
Yeah.
myself. And so, Tiffany, would you like to elaborate on that as well from your experiences or what you see through the March of Dimes?
Sure, sure. Just as you both mentioned, trust is important, and so is making sure that you feel heard and that your concerns, if you have any concerns, that they're being prioritized and addressed by your provider. And if you feel like they're not, then you should definitely consider choosing a different provider. And I, like Stephanie said, I think it's really important to keep saying that you can, because a lot of women don't realize that that's an option for them. And that's particularly true with women who are living with lower income. They often feel like they have to just accept
Yeah.
what's provided to them and that they don't have an option, but that's not true. And so you should absolutely go where you feel comfortable, where you feel safe. All of those things that Dr. Lambert Giles mentioned, you
Yeah.
should be able to see those things with your provider.
Mhm. Dr. Giles, thank you so much for Stephanie. You serve as the Division Director of Diversity, Equity, and Inclusion Faculty Advisor of the Maternal Health Equity Student Interest Group. Wow, you're doing big things. Can you touch on the challenges you've seen when it comes to assessing preconception care because of structurally racist systems? As a division director, what are you doing to combat this issue?
Yeah, I think, again, I want to start us from a place of recognizing what we mean by structurally racist systems. That's also a big trigger point for a lot of people. People hear the word racism and they clam up. They hear the word racism and they feel automatically on the defensive.
Right.
And I don't want us to feel that way when we hear the word racism. I don't want us to feel like we are attacking any one individual or any one system. And I think a lot of what my job here is in this role is really for us to settle the playing field and say, what exactly is the racism that we are talking about? Because sure, we can have individual racism when we are attacking an individual person, and that seems more personal from one-on-one. But so many of us don't recognize what it means when we talk about structural racism. So when we say structural racism, we're talking about this belief that has been created and fabricated in our work, in our school, in our environments, that says one race somehow is superior inherently than another. And by virtue of that, this other race, unfortunately, is kept in oppression by the laws that we create, by the housing systems that we have, by the job systems that we have. And we don't always recognize that even as people of color, that we participate in structural racism, right? So a lot of what I do is, one, truly trying to figure out what it is that we are doing in our system that is also falling under the category of structural racism. For example, in OBGYN world, we have a calculator. We had a calculator that tells us what is this person's chance of having a vaginal delivery after having a prior C-section. And this calculator used to actually include things like age, they include things like the patient's weight, it include things like why did they have a C-section in the first place. Prior to a few years ago, it used to include race. And when it included race, we realized that we had a markedly different result for the same exact patient if they were Black versus the same exact patient if they were white. And this system started to get interrogated, like, why is that? Why is there something that is different about this woman or this birthing person being a Black person if they have the same weight, the same height, if they have the same history medically? What makes it different of this person being Black versus the person that's white? And that calculator was what we used as a system, as an OBGYN, to counsel a patient to say, I think it's a good idea for you to try for vaginal delivery. I think these are your numbers. If I was to tell a poor patient, you're 60% chance of being successful, and I tell another patient, you're 30% chance of being successful, what's the patient going to choose, right? The 30% patient is less likely to choose, let me try to have a vaginal delivery, even though we know that that's actually a safer mode of delivery, safer for a mom, safer for a baby. Over time, it actually decreases her overall risk and her overall mortality and morbidity. But we are counseling patients in a way that's based on something structurally racist that actually changed our outcomes. I'm happy to say that in OBGYN world, we've actually done away with that calculator and adjusted it in a way that no longer includes race. But when we think of structural racism, we think of things like this that actually changes the way that we are actually counseling patients, that we are offering them care, and how we produce that care. And in this role, that's our hope, to continue to actually bring awareness to the things that we don't even know that we're doing or saying. And then when we find that, actually find ways that we can adjust our behavior so that we are trying to get better care and better outcomes.
Dr. Giles, thank you so much for that wealth of information. And while we're moving over, I had to come back to you really quick. Can you discuss why patient compliance with medical care is dependent on SDH factors, and what is SDH factors?
Yeah, so SDH is considered social determinants of health, right? There are a lot of things that might impact the way that I access healthcare, the way that I actually consume the healthcare system. And those things sometimes have nothing to do with my biology. Those things have a lot to do with my stability in an economic world. It might have to do with where I'm living. It might have to do with where I'm working. It might have to do with how I can get to care, my transportation, things of that nature. And sometimes it's easy for us to write patients off and say, oh, this patient is non-compliant with their medication. But we might not be asking the question of why are they non-compliant with medication? Is it easy for them to get to the pharmacy that we're sending it to? Or is the medication cost out of pocket too much for them to actually be able to get? Are they not tolerating the medication? Things that we aren't always asking sometimes really affect the social determinants that have nothing to do with the actual medicine, but has everything to do with how this patient lives, the education that they might have about a medication or a treatment option that other patients might not be experiencing.
Thank you so much, Dr. Giles. You're really schooling us this evening, and I'm so glad that we're having this conversation. Now, this is going to be a question to all of our panelists. We're going to start with you, Stephanie. Though preconception care is very important So is postpartum recovery. What resources and services does your organization provide to ensure one can feel supported as they go through their own postpartum recovery?
Sure. And postpartum is an extremely important period. There's so many things that are going on, just like pregnancy. But one thing that's very new is not only the recovery for yourself and your body, but also you have this new human being that you're responsible for, and you're all kind of learning one another. And as one of my doulas said, you don't, every baby has its own birth story. And so you don't necessarily know what that looks like. And so you cramming all this into a short period of time to where you and your baby are getting to know one another. You're having to be responsible for the care, the feeding, the safety and support of this little one. And then also remembering that you are just as important as well. And so at Urban Baby Beginnings, we really try to do a couple of different things. And we are addressing this really in the prenatal period because we're going over what it looks like to structure your postpartum recovery period in a way that you have individuals within your family and or friends that are available to you to provide support and resources and connections. We're also putting together a plan with your doula or home visitor to ensure that if you have any challenges, such as really knowing how to care for your baby or breastfeeding, maybe you're having a couple of challenges, that you have someone that's just there that can listen to what's going on and to help support you. And then the other thing is that we are providing resources to help you to understand in your recovery period what you need to look for if there is something that is not going the way that it's planned. And what that does when we put those plans together by the use of home visitors and doulas, and we even have nurses in our organization, that postpartum recovery period becomes so much better for the individual because they have these team of people that are helping. And the last thing I want to add to that in our services that we're providing is that this is a community approach. I often hear dads, they're like, you know what? It was my time at the birth and someone called me in and I was ready, but really I was ready during the whole pregnancy, but nobody ever tapped me in. And it's the same thing with like grandmothers and grandfathers and all of these different people. What we're really trying to do is to ensure as well that generations are all included and family and friends are included in this process because all of us have a responsibility for one another. And we don't want it to be that when a baby is born and a mom is at home in recovery, that we have included in other people to what's happening so that they can help ensure this safety of our moms and babies as well. So that's what we're really doing at Urban Baby Beginnings and providing that wraparound service and support. And we're also helping to mitigate risk by ensuring that for our clients and our members that are part of our service, that we collaborate with providers in the community to ensure that if something isn't looking right, that we're communicating in a way that we can keep everyone as healthy as possible.
Thank you so much, Stephanie. Tiffany, I see you nodding your head like this. I agree. Would you like to add to her comment?
Yes, I will say for March of Dimes, we have a lot of information on our website about postpartum recovery, about also your emotional mental health during that stage, what to look for, how to treat it, and that type of thing. We have a maternal mental health training that we also provide to increase awareness, but we also partner with other organizations like Urban Baby Beginnings that are providing those direct services in the community. And just to emphasize something that Stephanie was talking about, I think it really goes back to the old adage of it takes a village. I think that we've moved away from that a little as we've gotten more modernized and more spread out, essentially. But it really does take a village. And I think it's really important to lean on that, to have those supports in place, to make sure that everyone is involved in making sure that the postpartum period and even beyond that is successful, is happy, is healthy, and everyone can play a part in that.
Thank you, Tiffany, for that. It's so important. Dr. Giles, we want to pose that question to you as well. You were nodding your head also. It's important to have family groups and a village around you when you're going through this process, or just try to get your family members and your friends lined up during preconception. Would you?
Yeah, I agree with their sentiment. It is so important to have people around you throughout the process. After the process, I am newly postpartum myself, and I am like, been begging my parents to come move closer to me because of the importance of having additional folks to kind of help during this transition. I think that in our organization, we recognize that, and we recognize that the medical institution is not the best institution for that. You know, patients unfortunately are scheduled for things like 15-minute visits. And if I am seeing you postpartum, we're happy to see you as often as we need to. But a 15-minute visit doesn't always, wrap around that care that you need, where you are living your life, where you're actually caring for this baby. That's where you need that care. So I think one of the things that we are great at here at VCU is trying to include other organizations like Urban Baby Beginnings, like other community groups that we can try to connect patients that could be most helpful, get most use out of those services, so that they would have that wraparound care that's necessary and can be alerted to come into the medical system when something medical might be an issue. Our VCU Moms website is also great from a postpartum standpoint of just things that you might not have known. I mean, I was kind of like, yeah, sure, I know all the things about labor, but caring for a baby, no idea. I don't know. I thought that that was actually pretty helpful. And then now that we recognize the toll that depression and anxiety is really wreaking on our postpartum patients, it actually moving up to the number one cause of maternal morbidity and mortality. We have actually started a postpartum support group that can be accessed through Zoom links that patients can also find on our VCU Moms website. So I do think that we are trying our best to give people the understanding that if they need to access our care, to let us know, because we want to see you, but also to try to connect them to community services that can really meet them where they are, rather than having to come into the healthcare system for that.
Thank you. Dr. Giles, you said VCU Moms website?
Yes, VCUmoms.org.
VCUmoms.org.
Correct.
And so our moms.
And not just for moms, for all birthing people. My husband actually used the VCU Moms website more than I did during our pregnancy.
Yeah. Okay. Well, congratulations.
Thank you.
On the brand new baby. Now, if I didn't ask you something that you would like to say, here's your time to say it in about 60 seconds. Let's start with you, Stephanie.
I think the main thing is that we put ourselves as a priority. Remember that we need to have care and support through the lifespan. And then we don't discount the use of our family practitioners having our visits, and also our OBGYNs, and that we don't allow barriers to keep us from getting high quality care. And if there is care that is needed, you're discouraged, you don't know what to do, don't know where to go, and you're thinking about having a baby and or you're pregnant, I want you to reach out to Urban Baby Beginnings, talk to our navigators, and find out what your next step is, because you'd be amazed when we work together and share information together, just how that can change your trajectory and outcome and the support that you have.
And so again, for all of the resources and any additional information, repeat your website again.
www.urbanbabybeginnings.org.
Thank you, Stephanie. All right, Tiffany, tell us about the resources you have available, and if I didn't mention something that you want to add.
I just like to emphasize, use your voice. Don't be afraid to use your voice. You can ask questions, you can make comments, you can share your concerns, because I see a lot of women who feel overpowered by just the presence of a doctor, and you feel like they can't say anything to them or ask questions of them. So use your voice. If you feel like you need help or support in doing that, reach out to your resources like Urban Baby Beginnings. That's what they're there for. If you want to talk to someone from March of Dimes, you can check out all of our resources on our website at marchofdimes.org. And if you can also get in touch with someone there too by just submitting your name and email, we'll reach out to you.
Tiffany Carter of the March of Dimes, thank you so much. And you, Dr. Lambert Giles, let's talk a little bit more about how to gain access from your resources and services, and if you would like to add anything to this conversation this evening.
Yeah, I think I really just want to end on what we started with. I want people to make pregnancy a choice. Don't let it be something that just happens to you. Sure, in the rare instances, we can't prevent certain situations, but there's a lot of great things that we can do in preconception world to prevent pregnancy until you are actually ready for it. And when you make it a choice that you can commit to from a medical standpoint, from a financial standpoint, from a family standpoint. I really just want to make sure that we end on that. As far as our resources, at vcuhealth.org, you can definitely find our OBGYN resources. That's there. We have a very large OBGYN practice, but we also have a midwifery practice that a lot of patients would gain benefit from. Everyone doesn't need a doctor, right? Everyone doesn't have all of the medical complications that need to be managed in pregnancy. And our midwife team is great for that. Our midwife team is great for helping people through pregnancy, through labor, that might not need a ton of medications and things of that nature because of their pre-pregnancy disorders. So we're happy to help patients get the care that they actually need in order to have a successful pregnancy. And again, you can find us on vcuhealth.org, but then also at vcumoms.org with all of our specific things to pregnancy.
Dr. Lambert Giles, thank you so much for that wealth of information. Tiffany Carter with March of Dimes, thank you. Stephanie with Urban Baby Beginnings, we appreciate you so much. A lot of wealth of information. We had a lot of information shared this evening, but the most important one, plan the plan.
Please.
Plan the
We can
plan.
help you with that too.
And make pregnancy a choice. You heard it from the OBGYN. You heard it from these young ladies this evening, because we want healthy babies. We want healthy futures. And it starts at preconception. Thank you so much for being here. We would like to thank our sponsors, Virginia Neonatal Perinatal Collaborative and the Maternal Quality Care Alliance. And of course, again, to our panelists, you rock. So we want you to stay close, because the MQCA, we're going to be back with another episode real soon. God bless you.
Thank you.
Thank you. Bye.
Bye-bye.